Hi, I'm Professor Helen Stokes-Lampard. I'm Chair of the Royal College of General Practitioners based in the UK, and I'm a GP myself, or a family physician as you would know me. I've taken a serious interest in isolation and loneliness and the adverse impacts that these can have on the lives of our patients. I know as a GP that my patients' medical conditions are only one part of what makes them feel well or unwell. We talk about the biopsychosocial model. I prefer to talk about the physical, social and psychological issues that make up our patients' well-being. I always say to my trainees that the medical problems are usually the easiest bit of what I deal with in my patients' lives. There is an increasing evidence base about the adverse impacts of loneliness and social isolation, and I've provided some references to your colleagues, and I really hope that they help with your research. I know as a clinician and as a physician that I cannot solve the problems of my patients' lives with respect to their social challenges, but if I identify them, if I recognise that those problems are impacting adversely on health, then it is my responsibility to call that out and to signpost people to help. We've been pushing in the UK for social prescribing, a fancy name for what good doctors have always done, which is navigate our patients towards other resources outside of the healthcare sector that can help them. Sometimes it's an exercise class, sometimes it's company or a social group, other times it's rekindling an interest, making them feel they have a purpose in life. And social prescribing is really taken off. In the UK we have the year of our government. We've had a minister who in their portfolio has had loneliness, a minister for loneliness. That thing would never have been possible a few years ago. And so there is a narrative in the UK that I'm really proud of. I'm proud to be part of. And I'm very excited that you're embarking on this journey too. And I really wish you all the well in your research. And please do let me know how you get on. I'd love to help in some way if I can in future. Take care and good luck.